All right, thank you, Raul. Thank you, Erica. It's time for the Ask the Derm segment. Board-certified dermatologist Dr. Billy Groff from Cosmetic Laser Dermatology is here to answer your skin questions. How you doing, Doc? Good to see you.
Great. Good to see you, too.
Haven't seen you in a while. Let's get to the first question here. Lately, I've really noticed that chin and jowls are starting to sag. I guess because I am not getting any younger. I am 56 years young. Is there anything I can do non-surgical? Nancy in San Diego with a great question there. Doc?
Yeah, so if you look carefully at Nancy, you can see she's got some jowling or that kind of bulge at her jawline. And there's actually a couple good options, but my favorite option right now is a procedure called Thermi Tight because it's minimally invasive.
Wow.
Now here's a patient that I've done this procedure on. It basically involves using a probe underneath the skin to deliver heat, and you can actually melt fat with this probe too. And the procedure is painless because we use a numbing solution to numb the area along the jawline. Kind of like when you go to the dentist and they give you a couple injections and then you don't feel anything. We can do the same thing along here, so it makes it painless. And the recovery is quite simple. There can be a little bit of bruising, maybe a little bit of swelling, but the results are fantastic.
What's the turnaround for something like that?
You mean as far as how long does it take to do? It usually takes about 45 minutes to do, and then the recovery, like I said, a few days of swelling and maybe some bruising.
Okay,
so
all right.
Great procedure.
Yeah, absolutely. Next question here. I'm a college student, and I really don't have time to be applying skincare, and honestly, I'm afraid to take antibiotics. Is there a quick, easy fix for acne? That's Edward at USD. Wow. There's the
so
right
Edward's got some acne and some scarring in addition to that. But first we want to get control of Edward's acne. And a lot of teenagers and college students don't have time or don't want to apply topicals, and they're too busy and they just don't do it. So we have a laser procedure called photodynamic therapy where we apply a medicine on the skin, and then we use a couple different lasers to activate the medication. And you can see, as in this patient who we treated, it makes a huge difference in the acne. It's probably the quickest way to get acne under control without using medications and topicals and things like that.
That's, wow, the before and afters were amazing on that.
Thank you.
We'll go to the next question here. I've been training a bit more aggressive in preparation for the San Diego Triathlon Challenge in October and started to notice some type of skin reaction. I went to my local dermatologist and they say it's caused by excessive sun exposure. Is this true? Paul, Rancho Penasquitos.
Paul,
is it true, Doc?
Yeah, it is true actually.
Okay.
If you look at if you looked at Paul's neck, you can see all that mottled red discoloration. That's basically radiation damage to the skin. It happens over a period of time with prolonged exposure to sunlight. It's called poikiloderma of Savant, big medical term.
That's what I was thinking when you were talking about
Yeah,
that.
you were about to say that, I think. I sorry, I didn't mean to take the words out of your mouth. But we can treat this with a laser. I mean, we got a laser for everything. It's crazy. But we can treat with a laser called a pulse dye laser, and the laser will take that redness away. Usually with one treatment, you can get about a 70% decrease, like you can see in this patient that I treated for the same condition.
Is that the wave of the future? Are lasers going to be the wave of the future for most things, you think?
You know, put it this way, we have about 45 different lasers at our practice, and there's a reason for that. I mean, we don't want to have that many, but I mean, there's so many different things you can do with lasers now. So yeah, it really is.
That's incredible.
Yeah.
It's incredible. All right, question number 4. My daughter has a red mark on her face below her right eye. Over the years, it seemed that it comes and goes since she was a toddler. She is now 11 and continues to have this issue. Any recommendations, Dr. Groff?
You know, I love taking care of kids that have this problem. This is what's called spider angioma, because if you look at it, it looks kind of spiderish, with the center red dot being the body and then the legs being those red projections going out from it. So again, what we can do with this type of, it's actually a blood vessel at the surface of the skin. Okay, so we have lasers that 1, 2 zaps, gone. So it's pretty amazing. So I love seeing these kids because it really bothers them. Here's a little boy, actually. You can see he has one under his right eye.
Right.
See how he's all upset and kind of bummed out. Now look at him in the photo afterwards. After I got rid of it, he came back about 4 weeks later, and look how happy he is.
Wow. Big smile on his face.
Yeah, cute little guy, right?
Hey, Doc, I got to ask you real quick a question before you leave.
Sure.
Have you ever said to a patient, when the patient walks in, I'm going to use the laser?
Oh, I love to say that. I do my best Austin Powers impersonation.
It's fantastic.
I love it.
Thanks for the info. Great stuff this morning. Great to see you. Yeah, to get in touch with Dr. Groff, all the info was on your screen right there. There's the phone number, 858-657-1002, or you can go to our website, fox5sandiego.com, and click on that See Now tab. Thanks. Great stuff.
Yeah,
Always
great
good to see
seeing
you.
you. Thank
Guys,
you.
back over to you.